And I'm delighted to say our next speaker is Dr. Jenny Goodman, who practices from Biolab. We've known her for many years. She's a very good friend of Biolab. She's seen hundreds and hundreds of patients. And I believe it's true to say that your introduction to this was at a Biolab workshop, this whole field.
Yes, exactly 21 years ago, I got a leaflet about nutrition in childhood asthma, which you sent me. I don't know how you got my address, but I'm glad you did. And I went, oh my God, there's other doctors that want to do it differently. So yeah, thank you. All right.
So yeah, Jenny was going to give us some case presentations this afternoon.
I am, yeah, change of emphasis. But first, I do want to say I'm sorry I wasn't here this morning, but I learned so much this afternoon. And Rachel, it's all amazing. Two particular things I learned is that you can abbreviate oxidative phosphorylation. I could have been saying oxphos, and all these years I've been saying oxidative phosphorylation, and I've even learned how to spell it. And suramin sounds amazing, so I assume it's banned. Yeah. Okay, yeah, complete change of emphasis, not quite so much science. These are two case histories, both fairly recent in my practice. And I'll be honest with you, I mean, mitochondrial function features in both of them, but it's not central. It's not the sole factor. All disease is multifactorial. So the mitochondria will be in the presentation, but they won't be, they won't be the only thing. Okay, so the first one is a case of multiple sclerosis. And this is unusual. Normally, when people come with MS, they've had it for years, or they've had it for decades. And you think, oh, if you'd come immediately. But this guy did, okay, so he'd only had 4 months of very severe symptoms, and particularly blurred vision. He could hardly see. It was very sudden, severe headaches. And within 4 months of developing these symptoms, he had a diagnosis of MS. And he had numb bits, he had painful bits, and his primary concern was his vision. The optician sent him to an ophthalmologist, who sent him to a neurologist, who said, oh dear, and then he came to see me. Now, of course, my question is always, what sparked it off? No, I've got to go back. What are we looking at now? No? Okay, what sparked it off? Usually, it takes months of detective work, and it's never just one thing. But 5 months previously, remember he'd had 4 months of symptoms, he'd had a massive exposure to insecticides. He had his office sprayed for cockroaches. He didn't know which one it was, but cockroaches are very hard to kill, and insecticides are not good for cockroaches or humans or other living things. But the spraying people told him, don't go to your office for at least 48 hours. Now, I mean, I would have said 48 years, but anyway, he ignored it, silly man, and he spent the whole day in his office the next day and the next and the next. Within a month, he couldn't see straight, and he had these terrible headaches, and he got the diagnosis. However, his mum and 2 of his sisters were already patients of mine, and so the whole family were thinking natural. So he put himself on the Terry Wall diet, gave up on the neurologist, and came to see me. So although I say we know what sparked it off, of course, that's only the final trigger. There are always many, many other things in the background. Any serious illness is multifactorial. So this turned out to be his final exposure to insecticide, but all sorts of other things were going on. So he had a mouthful of mercury, that's metallic, inorganic mercury in his teeth, but he also ate 2 tins of tuna every day for lunch, and he'd been doing that for years. So now we've got the so-called organic mercury, the methyl mercury added. He lived on these junk-filled soya sausages, and he heated them up on a plastic plate in a microwave. And there had been an occasion where the plate melted. And we will see later on that the chemical that was produced by the melted plastic plate was attached to his DNA. He was hooked on artificial sweeteners because, of course, he's heard that you're not meant to have sugar. So he's having loads of artificial sweeteners, which are even more dangerous. And he had no good fats in his diet at all. And there were more contributing factors. Excessive use of the mobile phone right next to his head, He didn't sleep because he was so important. He had too many things to do. So he only slept 6 hours a night. He had worked on a building site for 2 years, which can involve a lot of exposure to lipophilic chemicals. He was a frequent flyer, so he was exposed to nickel and all the toxins on aeroplanes. That's a whole nother topic, aerotoxic syndrome. And he'd had a lot of spraying previously for ants. So the insecticide exposure, which triggered the MS, was not his first exposure. And you'll see in a minute, he found a lot of nutrient deficiencies. By the way, the doctors, the GPs in situations like this will say things like, it can't be pesticide poisoning. He has a diagnosis. It is multiple sclerosis, as though that is some kind of explanation or mechanism. It's just a label. It's a description, but it's no more scientifically sophisticated than 19th century taxonomy. It's purely classification. It tells you nothing. Yes, it was MS, and yes, it was pesticide poisoning, and it was all these other things as well. Okay, family history significant here as a contributing factor. Sister has Hashimoto's very badly. She's very young. Father's mother had epilepsy and a brain tumor. Mother's father had Parkinson's. So there's a lot of neurodegenerative stuff. There's autoimmune stuff. And the mother's family has a lot of diabetes type 2, although not the mother herself, because she's a patient of mine. So these genetic tendencies are predisposing factors. They make you more vulnerable to encountering all these nasty things. Sorry, I'm reading the slide after next because this is confusing me. Someone should have told me.
Your current slide is the one on the left.
Yeah, I know that theoretically, but I'm looking at it.
Our virtual audience is saying, can you speak into the microphone, please? Rather than looking at the phone.
Oh, the mic. Yes, okay. Look, shout if you can't hear me, if I'm talking something that isn't on the slide. Okay, so we've talked about the contributing factors, and there are others. Now, these are the ones I have found in other MS patients, right? So he happened not to have any of these, but he had enough to be going on with. History of head injury seems to be linked to MS, and also chronic fatigue syndrome. Sarah, have you seen that? Yeah. Dental infection, exposure to VDU screens. Anybody old enough to remember these huge bulging VDU screens? The first computers were like that, and they gave out tremendous amounts of radiation. So yeah, dental infection, chronic low vitamin D. So you see someone, you find their vitamin D is terribly low. It's probably been low for decades, and that's a huge problem. And I also see people who've had years of eating sugar, drinking Coca-Cola. Has anyone seen an MS patient without a mouthful of mercury? Okay, there you go. And family history I've been through. Okay. So the next consultation, we went through a lot of test results. Vitamin D was 60. That's not too bad. But of course, he'd done some reading and started taking it. You know, it might have been 20 for many years. Vitamin E was vanishingly low. All forms, yeah, because biolab test, alpha tocopherol, but also delta and gamma tocopherol. Zinc was low, iodine was low, and fluoride was high. And homocysteine was high at 14.5. But, you know, I've got other MS patients in whom it's been like 27, 29, 30. What else? ATP production in the mitochondria was low. Low level of ATP in the mitochondria, but also low level of ATP in the cells themselves. So that's what's available to be used to make energy. That was low. Now, we used to be able to test all this. We can't anymore, but ATP-associated magnesium, the magnesium that's in the mitochondria for the ATP to use, was low in this person, even though his red blood cell magnesium was normal. So probably somebody cleverer than me, like Sarah or Rachel, will be able to explain that. But I did give him magnesium anyway. You know, the ATP rapidly decreased on energy demand, and the clinical correlate of that, of course, is delayed fatigue, and very slow at converting ADP back to ATP. Yet more test results. Now, toxins. Mercury and cadmium attached to a protein called metallothionein that really its business is to carry zinc and copper around the body in a 40-60 ratio. That's what it should be doing. Lymphocyte sensitivity, which is a bit like the ELISA test but different, was raised to both types of mercury, metallic and methyl. And lymphocyte sensitivity was also high to this polyoxyethylene esters, That's from the melted plastic plate in the microwave. And the most significant of all, mercury was stuck to the gene that codes for the protein in the myelin. Let's pause there. This is extraordinary. You don't normally get such a neat correspondence between the test and the clinical picture. So myelin is the fatty sheath around the nerve, and that's what gets eaten up by the immune system in MS, but it has protein in it as well as fat. And the gene that codes for the protein had a mercury complex stuck on it. So it was going to produce either no myelin-based protein or more likely a distorted one. And of course, if the toxic metals like mercury and cadmium get directly into that protein, then they're going to distort its structure. And the immune system is going to say, that looks weird. That protein doesn't look right. I'm going to destroy it. It's not because the immune system's stupid. It's because the protein is poison. So the conventional approach, of course, is smash the immune system with steroids and other immune suppressants. No, it's doing its job. It is reading correctly. It's seeing an alien protein. Alien because of heavy metal poisoning. Okay, and yeah, I've told you about the plastic plate melting. That was stuck to the DNA as well. And also PDCB, that's para-dichlorobenzene, a very, very common insecticide. And it's not just being sprayed around, it's in those translucent purple blocks that people have in the toilet sometimes. And it's moth killer as well. The mothballs, which are also purple, that's para-dichlorobenzene. And it's a very common toxin and it's very, very nasty. And last of all, I've put low glutathione on this slide because glutathione is the most important molecule for so many of our detox pathways. And when it's low, it can mean two things. One is genetically, you're not very good at making it, or you've got so many toxins on board that you've used it up trying to deal with them. Usually it means both of those things. And of course, you can do genetic tests to see. Okay, the gut test, the comprehensive stool analysis and parasitology through Biolab with doctor's data showed a few nasty bugs, very low lactobacillus, an unusual candida, and secretory IgA very, very high. He didn't have any colon or intestinal symptoms. He just had a bit of indigestion when he ate too fast. So there's a bit of a mystery. So what do we do? He was already on a strict Terry Wall's diet, but she excludes eggs because they're a common allergen, but they're a very good food. And he needs the phosphatidylcholine and everything else that's in the egg yolk. So, you know, always saying they have to be organic and they have to be free range. I put eggs, avocados, and good fats and oils into his diet for the first time. Supplemented the missing nutrients, more iodine than you would just to normalize the iodine level, because he had fluoride in there, probably from the dentist. You know, dentists don't ask or tell you, they just put fluoride on your teeth. And I supplemented all the B vitamins, including methyl B12. Then a month later, add in the methylfolate. You have to do it that order to avoid the folate trap. And with ordinary B vitamins as well, that will bring down the high homocysteine, and it did very rapidly. And this is what I do for detox. And of course, you're getting the toxins off the mitochondria as well as out of every other part of the cell. Very high dose vitamin C. I'm sure Sarah's dealt with how to do that. I won't go into it. Reduced glutathione. I don't mean not very much glutathione. I mean in the reduced, not the oxidized form, so it can do its job. PC, phosphatidylcholine from Body Bio, although it's hideously expensive, but the other kinds don't seem to work. 4 teaspoons daily. Some people love it, take it off the spoon. This chap did. Some people hate it. You can get them to mix it into coconut yogurt with some berries, and then it's very palatable. Organic green vegetable juicing every single day. If I could only do one treatment, that would be the one. Epsom salts baths obviously gets the magnesium in through the skin, and safe removal of all the amalgams. Now, he was the sort of chap that was going to run out the second consultation and have it done by the high street dentist. So I had to be very firm. Don't do that. Have it done by a specially qualified, safe dentist, and not until your nutrient levels have normalized. And get a water filter, because although he was based in London and they haven't yet put fluoride in the water in London, touch wood, they will, but there's chlorine in there, and that wasn't going to help. Okay, so saunas, colonic hydrotherapy, I wanted him to do as well. but he didn't get round to it. And by the time he was willing, we were in lockdown. So he still hasn't done that. So it's remarkable how much he has improved. Okay, no more pesticides, promise. And the usual stuff for the gut, the probiotics. Now, normally I wait a year to repeat the stool test, or don't do it at all if the person's symptoms have gone. He was impatient. So instead of doing 4 months of each herb, I did 2 months, which is good because you can get resistance to herbs as you can to antibiotics. So you keep the bugs guessing by changing the fungal antifungal herbs. Repeat stool test showed the secretory IgA down from 586 to 286, but it needs to go down further. Even though his red blood cell magnesium was all right, I gave him magnesium for the mitochondria. CoQ10, I gave him obviously ubiquinol, 100 3 times a day. It does normalize quite quickly, and I would do the blood test and repeat it. And within 2 or 3 months, he was down to just taking 100 milligrams once a day at breakfast. Vitamin B3, in addition to what's in the B complex. Carnitine, it is very important, but he was eating red meat, even though he wasn't supposed to. And I found it's only a problem in vegetarians and vegans. Okay, so then I saw him for the 3rd consultation. His energy level was improving, his vision was improving. He had sensation coming back into his face, his feet, his fingers. He only got headaches if he was under stress. And most importantly, he was sleeping normal hours. He was going to bed at 10:30, not 11:30, and he was sleeping until about 7, which was great. And his amalgams had just been safely removed at that point. Then by June 2019, his eyesight was normalized. The optician was a bit puzzled, but okay, fine. You know what they say, don't they? Oh, well, the diagnosis was wrong. We have MS. Headaches were very rare. He had been very chemically sensitive, feeling sick in perfume shops, and that went away. Occasional numbness in his face, occasional back pain, occasional other symptoms. Energy level better, but dips again by early evening. So, you know, repeat the test, tweak the supplement regime, and he kept falling off the wagon. So he'd get weakness and facial numbness and thigh pain whenever he ate cake or anything sugary, because he kept giving in to his cravings. And some of the symptoms he'd get when he ate sugary stuff were not symptoms he originally had. You know, he acquired new symptoms when he cheated. Also, when he stopped the phosphatidylcholine or stopped the good oils. And hard as it is for people to give up the junk, it's often even harder for them to remember to take the good stuff. You know, people aren't used to pouring hemp oil on their salad or frying everything in a large quantity of coconut oil. He had to get used to that, and he kept forgetting. As soon as he goes back to his regime, he's better again within a fortnight. Okay, jumping a few. 7th consultation was October last year. He did get COVID, but he recovered okay. Then everything in his life slid into chaos. He's got about 6 children, and you know, so he forgot to take all his supplements. He slipped with the diet. Headaches came back, back pain, chest pain, itchy legs, none of which had been part of the initial presentation. Then he stopped wheat and dairy, resumed vegetable juicing, and resumed the Epsom salt baths, back on the wagon. Within 2 weeks, he's better. So 8th consultation, he said, I really learned that if I deviate from the regime we've worked out, and I say worked out because we were not sticking fanatically to Terry Wall's diet, but we worked out what worked for him. Instant headache, chest pain, weakness, and faintness. And, you know, those relapses are part of the therapy, because the patient learns it's not fair. Other people can get away with eating rubbish, but you can't. And he got it. I want him not just to stick to this regime, but to also introduce colonics and saunas. But I'm not, you know, I don't rate my chances really. We'll see. Check in a month's time. That'll be my final consultation with him, because I'm retiring in late November. Okay, stop, stretch, oxygenate your brain. There's been a lot of info to take in. It is 4:30. I mean it. Do feel free to get up and stretch and get some oxygen to the cerebrum. I've got 10 minutes. Okay. This next case history is much shorter, but not nearly as cheerful. Okay. That was it. You've stretched, you've taken a breath. Let's get going again. Okay, so dementia's like cancer, right? Prevention is a lot better than cure. And this is a patient, I promise you, when I retire, I won't be referring to any of you because it just wouldn't be fair. This is a patient from hell, but really more because of her social situation than because of her illness. You can treat dementia quite successfully. If you get it early, you can hold it, you can stop the deterioration. But this lady came September 2017, so 4 years ago, 78, already diagnosed with Alzheimer's, white patches on the brain scan, previous history of anxiety, depression, constipation, which of course is significant, mild high blood pressure. And she'd been on statins and thyroxine and perindopril for the blood pressure for years and years. Now, 1 minute she'd complain about memory loss, the next minute she was in complete denial, very muddled, brain function slowed down, couldn't hold anything, but also very tearful, which is part of it, confused and helpless. When you've got somebody like that in front of you, confused and crying and helpless and muddled, it's very hard to tell how much of that is organic brain damage and how much is distress about the brain damage. Because most intelligent people, they know what's wrong and they feel so distressed about it. And when you're that distressed and anxious, you can't think straight anyway. So very hard to untangle that. Right, she'd been eating rubbish forever. Lots of sugar, no good fats, absolutely addicted to flora and low-fat options because she believed the propaganda that began, what, 40, 50 years ago, when John Yudkin wrote Pure, White and Deadly and was shot down in flames. And the story became, no, it's not sugar, it's animal fats that cause heart disease. And, you know, flora made trillions out of that. And she was one of the people who believed them. So throughout the treatment, it's been really hard because she's so addicted to low-fat spreads and low-fat yogurt. That's in her head as what's healthy. She's already got dementia. She can't get the old information out, new information in. She couldn't give them up. And when I would sit there saying, you've got to eat butter, coconut oil, sunflower, safflower, cold pressed, blah, blah, organic virgin oils in a dark glass bottle, keep them in the fridge, put them on your salad. What salad? She's thinking. And she's thinking, butter? Are you crazy? She's thinking. So this is what you're up against. She also ate very little green veg, and that she was willing to fix. Cooked green veg, it fixed the constipation, which obviously helped. She forgot to drink water, right? It's common, this, in all of us as we age. The thirst mechanism stops working. I don't know why. One of my clever colleagues over there probably knows why. But that is going to contribute directly to brain malfunction and to constipation, which also contributes to brain malfunction. It's a vicious circle. You forget to drink, so your brain dries out, so you forget to drink. You know, everybody over the age of 70 needs somebody saying to them every hour and a half, have a glass of water, mum, have a glass of water, dad. Okay, other obvious factors, right? She didn't exercise. She just didn't want to. Stool test, some unfriendly bugs, low secretory IgA. The best treatment for a low secretory IgA is chicken soup. I would like to give it PR, but there's no colonic hydrotherapist doing that, and nobody's giving it IV either. She wouldn't take bone broth because she wouldn't buy it, it was too expensive, and she wouldn't cook it because she didn't cook. Okay, with anybody like this, you give them B12. I wouldn't even bother to do the test today because the test isn't normal. It means, the normal range means, and actually you could consider changing your normal range, thinking about it. This normal range is built based on how much you need to prevent pernicious anemia and subacute degeneration of the spinal cord. It's not based on what people over 50 need to keep their brain alive. So yeah, the result was so-called normal, but I gave her loads of B12 anyway, treated all the other deficiencies. Mitochondria. I'm just justifying being here, Rachel. So mitochondria, okay, seriously, very, very, very low ATP production, much worse than the chap with MS. So I gave her all 4 mito medicines. Magnesium, 3 ways to give magnesium: oral supplementation, Epsom salt baths, and green leafy vegetables. Cooked green leafy vegetables, because you get much more mineral absorption when it's cooked, especially in someone like her with compromised gut function. CoQ10, massive doses. Carnitine, yes, I did. And B3, as well as a B complex. Didn't give her D-ribose. Let's have a discussion later about what it does to the gut bacteria, because I don't know. I think there's a problem. If you could take the powder sublingually, maybe you wouldn't encourage your unfriendly gut bugs, because it certainly helps with energy. So all of this helped with her mood. It helped with her energy levels, so long as she continued to take it. But, right, okay, so what had caused it in her case? Low vitamin D, right, so low vitamin D3 and lots of units of D2, which is the junk version. And if the GP tests the vitamin D, that would have come up at 41. Yeah, no, 51 would have come out at 51. So they would have said not too bad, even though that's still low, because they add D2 and D3 together. Only the biolab test differentiates. And very important, you want D3, that's what we make from the sunshine. You don't want D2, it sits on the receptors and gets in the way. So that was one contributory factor. Aluminium, sky high from all the sources. She had it from all those sources of aluminium. You get rid of it with silica. Read Chris Exley, Professor Chris Exley on aluminium if you haven't already. And very high dose vitamin C, and an attempt at explaining the sources of aluminium and how to avoid it in future. And of course, it was also contributed to by her long-standing low-fat diet, the excess sugar, and being on statin drugs. Her poor old brain didn't have a chance, you know, all fats had been removed from her system. Now, those causes plus mercury toxicity and, yeah, other heavy metals are the commonest factors in dementia of all types. And having done this case history, I then saw they overlap very considerably with the causes in the dementia case history in my book, right? I forgot to bring any flyers. It's Staying Alive in Toxic Times, a seasonal guide to lifelong health, published by Hodder. And it's a much more cheery case history than the one I'm giving you now. It's on page 234. The contributing factors, almost identical, but the patient responded completely differently, because the one in the book did what I said. This lady couldn't. Okay. What number slide am I on? I can't see. Okay. Yeah. So this lady took the supplements, but she wouldn't give up her sugar. She wouldn't cook proper meals. She was already so poorly that she got in a muddle ordering the supplements. Now, what was needed and what you have to have in place if you're going to take on someone with dementia is another competent adult very closely in the picture. A supportive, proactive person. Could be the husband, friend, neighbor, a grown-up child, to help her organize her food, supplements, make sure she's sticking to the regime, make sure she's hydrated, put a big chart up on the wall. Mom, take this at breakfast, take this at lunch. This woman didn't have that. She had a husband who'd never cooked a meal in his life, was in complete denial of the problem, and wouldn't even help her with her muddled up paperwork. So it's very hard to treat someone in that situation. We got some improvement, especially in the first 2 or 3 years. I think you can slow down neurodegeneration, but we obviously couldn't slow it down as much as we could when there's a compos mentis helper around. And then with lockdown, she was so distraught that she became incapable of doing anything. But here's the bright side. If you catch dementia very, very early, ideally before the diagnosis, and the case history in my book, she did have a diagnosis, but she only had a subtle memory problem. She was so concerned herself that she went and got the diagnosis. But if it had been left another 2 or 3 years, it would have been much harder. And this is where, if eco-medicine, what we all do, natural medicine was the first port of call instead of the last, we would have even more success than we do. Because conventional medicine is great for the emergency. But, you know, in the early stages, what we do works. Okay, any questions?
And also with dementia, if you can just slow it down in elderly people, they're likely to die of other causes of disease before the dementia has a significant impact on their life. So even just delaying the progress.
Yeah, but hopefully what you're doing is preventing other diseases as well.
Yeah.
I mean, we should all have the right to die of old age, shouldn't we? Peacefully.
You asked about D-ribose and the fact that you risk, feeding and fermenting up. If you're on a keto diet, the bugs aren't there to absorb it. D-ribose is a monosaccharide. It's rapidly absorbed in minutes. 95% is rapidly absorbed, so it's not a problem.
They don't get a chance to feed on it.
No.
Thank you. Brilliant.
I've got a question from the webinar that people have been discussing. What water filter do you recommend? Reverse osmosis, distilled?
Yeah, there are two water filter companies that I rate quite highly. One is called the Freshwater Filter Company. Sorry? They don't anymore. Okay, so the other one I use is Silverline, based in Devon. And I'm sure there are many other good ones. But my criterion is, have they just jumped on the bandwagon and started making water filters last year, or have they been in the business for a while? Osmio, okay. There was a question at the back there.
Tom?
Yes, just wondering about what test you use for the aluminium.
Can't hear you.
What test do you use for testing aluminium?
And also on aluminium, someone's asked, would you advocate chlorella for aluminium detox?
And malic acid.
I don't know about chlorella. I use it for mercury a lot, even though a lot of people say you shouldn't. And I don't know whether it works for aluminium, but there are two things that take aluminium out of the system. One of them is silica, which actually binds with it and takes it out. And vitamin C helps that a lot. And the most important thing then is to not take any more into the system. The test, yeah. Okay, so we used to have a wonderful lab called Acumen, which could look for these things in a really sophisticated way. We don't have anymore, but there are other ways of looking for heavy metals, and Biolab has got access to the labs that do that. So it's a question for Mark afterwards, I think. Yeah. Okay, so yeah, Fiji water is okay, but you'd have to drink gallons of it. I mean, it has got a higher level of silica than other mineral waters, but it comes in plastic, right? And you want your spring, sorry, it's distracting me. You want the spring water in glass, not plastic, because plastic is carcinogenic. But what I use is from a company called LLRG5. That's their Silica Organique. Silica Organique. It's a French company based in the Republic of Ireland, just to confuse you. And it's liquid. LLR-G5. And it's 30 mils a day. And what I find is you don't need to do it all the time. It's 3 months of the year, the aluminium goes down. But if people will keep on insisting on having their flu jabs, they're going to have aluminium in their system. Yeah.
We'll just take one more question from the gentleman at the back.
Okay, hi, thanks. Phil Hawes. You've mentioned many deficiencies, and we all realize the problems with deficiencies in various minerals and vitamins, etc. And now the topic of water's come up. I'd just like to make a comment, because water is so important. And what I believe is that water is being affected by the electronic magnetic frequencies that are disturbing the cluster size, the nature's cluster size of water, which is then not enabling people to hydrate their bodies properly, because the water is not entering the cell properly. The frequency of the cell membrane is being affected, and therefore the cytoplasm, which is protecting the mitochondria, is not constructed properly because of the lack of hydration, proper hydration in the body, and therefore the mitochondria is not producing enough energy. And I think that's a major problem, and people really need to understand a lot more. There's a lot more about water, because we are beings of water and we're electrical beings as well.
I think that's absolutely right, but our next speaker, Gillian, is an expert on that, and I'm not.
She is,
so
yes,
maybe
absolutely.
she can answer your question.
Thank you.
All right. So thank you very much, Jenny. That was fascinating.